Done.
Okay, yeah, I have 12 o'clock. So hi, everyone, and welcome. This is Melissa. I'm sorry that you can't see me today, but I am having some computer issues. So thankfully, Amy is going to help us walk through the slides. Amy, if you want to go to the next slide. I'm going to give us a chance to have you go ahead and chat in your questions. It occurs to me that I won't be able to see the chats either, Amy, so maybe I might have to try and log back in separately after we get to Casey's piece. But so please log in any questions that you're hoping that we're going to cover. And I just wanted to say welcome. We haven't talked in a month. It seems like a very long time. I hope you all had some time to take off or relax or restore or just recenter as the new year began. I know that I took some time and it was wonderful, but now we're right back in it. So with that said, we have a lot to share today. So we are going to go ahead and get started. Next slide, Amy. So we're going to cover some data and trends. We're going to go over the coronavirus mutations that I'm sure you've all been hearing about. We're going to spend a lot of time talking about vaccines, and we're going to spend a bit of time talking about the BIPOC community and outreach tools that we found for that. Again, please feel free to chat in anything else that you might be hoping that we will cover. Next slide, Amy. So we have our Vermont data, our Minnesota data, and our Rhode Island data on the screen. And I have to say the thing that stands out to me the most is what's actually in your upper right-hand corner, which is the SASH data. Assuming that everybody is using those tabs to document when they have a positive case, the thing that's really interesting to me is that we are seeing exponential growth in positive cases in all 3 states, but we aren't seeing that reflected in the SASH data. So I'm not sure if that means people aren't using the tab or if it means that they are, and we're just doing a really great job of keeping our participants educated and safe. I'm really hopeful that it's that second one, but I understand that it could very well be the first as well. Regardless, though, the numbers are climbing everywhere. And then I guess next slide, Casey can talk us through all those numbers.
Yes. Hello, everybody. Thank you, Melissa. So I wanted to take a little bit wider view and just look at the national data and how it may at some point affect Vermont, and certainly the high case numbers are very much affecting Rhode Island and Minnesota. As of today, there's 22 million cases in the United States. I pulled these numbers yesterday, and there's over 367,000 deaths with, as I'm sure you heard, over 4,000 deaths in one day last week. And I think importantly, the hospitalizations in the United States continue to climb. So the numbers keep going up, and we're going to talk about the impact of that a little bit on our healthcare systems and what that looks like. A number that is standing out to me and a little easier, I think, to conceptualize is the cases per 100,000 over the last week. And that puts it a little bit more into perspective as far as how big or how many people live in each state and what that means. So in Vermont, we, over the last week, are averaging 23.6 cases per 100,000. Rhode Island has a huge number of cases right now. They have over 130 cases per 100,000. Minnesota's at about 42. And California, where we're hearing some of the worst stories as far as the healthcare system, is at 99. So California has less cases per 100,000 right now than Rhode Island. But when you look a little deeper at that, it's interesting to note that LA County, which is where you're really hearing some of the worst stories of healthcare crisis, is at 143 cases per 100,000. So they're even higher than what's happening in Rhode Island. And just for some perspective, because we are going to talk in a moment about the mutations in England, where this new variant is the primary form of the virus, they're reporting a case count of over 590 cases per 100,000. So much, much higher even than what's happening in LA County in California, where it's kind of at its worst right now. So the new variant is certainly very scary because of those case counts. And while the new variants aren't expected to increase the death rate, they do just increase the number of people who test positive. So that's going to affect the number of people who get sick and the number of people who are in our hospitals. The graph over on the right is showing hospitalizations, and you can see that there was that big peak in April and another peak in July, and then now things are really spiking. We're more than double where we were both in April and in July. So definitely very concerning numbers, and as Melissa said, things are rising all around Vermont. Quebec is currently in a lockdown, and cases are going up in all the states around us. Next slide, Amy. So the reason we're concerned about those numbers going up, I mean, certainly we don't want any person to get COVID, and the risk for anyone is significant. But collectively, as a state and as a community, we're really very worried about healthcare collapse, because when the healthcare system collapses or is overwhelmed, then nobody can get good care. And the care suffers for all patients, regardless of what's going on for them. And you've probably heard people talk about healthcare collapse in the media, and what does that mean? It certainly doesn't mean the hospital falls down or nobody shows up, but we're seeing a level of healthcare collapse right now in LA County in California. As I mentioned, that's where it's the worst right now. And what's happening there is they've increased the nurse to patient ratios. So nurses are having to take care of a lot more sick patients at one time. They're asking emergency services to conserve oxygen and not give oxygen to people unless they're really very low. They're asking ambulances not to transport people if they have a significant cardiac or traumatic event where their heart stops and they can't get it to restart. Then they say don't bring them to the hospital because their chances of survival is so low. There's long waits in the ER. We're also hearing concerns about shortages for ventilators, that they're having to ration ventilators toward people who are more likely to survive. Definitely concerns about adequate medications, enough beds. I heard an anecdote this week that they had beds in the gift shop. And across the board, across the country, definitely hearing about staff shortages. And the reason I bring this up is that that's really what is driving both our push to get lots of people vaccinated and to kind of get ahead of these mutations, which might greatly increase hospitalizations and the stress on the healthcare system. Next slide. So a little bit about the new mutations. I'm sure you've heard a lot about them on the news. The one in England that was identified back in November is B117. There's various reports of it being from 10 to 70% more transmissible. And what's really concerning about that is we have a certain set of tools that we are using to prevent transmission. And those are masks, those are distancing, and then kind of a final measure is lockdowns. And what started to happen in England is that those measures are just, they're just not working. So that the virus continued transmission even after the city of Kent went into lockdown. So that is certainly a concern and about a possible additional surge in the United States. We do believe it's here, probably even here in Vermont. There's been over 50 cases identified so far, and as close as Saratoga Springs. And with the cases surging everywhere in the country, it's probably a lot more widespread than that. The way they believe, there's a lot of studies going on right now about these new mutations, but it's believed that it is more contagious because there's higher levels of virus in the respiratory tract, so that when somebody talks or yells or coughs, just more virus is put out into the air. Right now, fortunately, they believe that the vaccines will still be effective against this new mutation. Next slide. The other new variant has been identified in South Africa. This one is a little bit more concerning because it has some changes to the spike protein. And as you may know, that's what the new mRNA vaccines are based on, is on these spike proteins. But preliminary studies by Pfizer indicate that the vaccine will still be effective. This variant also causes an increase in transmission. It's also believed not to increase the risk of death. And again, that's the risk of death for any one individual, and it's certainly going to depend on the stability of the healthcare system. Next slide. So kind of in light of both the huge rise in cases everywhere and the rise in cases in each of our states, and also with these new variants coming, there's a real push right now to redouble our prevention efforts and step up the protection that we're all doing, that we're all really tired of doing. But I think this is really important to highlight, both for us as SASH staff, but also with our participants, that we need to maintain our distance. 6 feet is good, but farther away is even better. Certainly being outside is better, but the virus can spread outdoors. So, you know, we've all probably gotten just a little bit closer to people. And so it's time right now to start taking more steps back and have a little bit more distance. There may be ways that participants can improve their masks. SASH staff should be wearing surgical masks for all of your work. I hope you can still hear me. My computer just died. Can you still hear me, Amy?
We can still hear you, Casey.
Go ahead.
Okay, I'm not sure where my screen went, but hold on a second. There we go. And so we should all be wearing surgical masks, but we need to make sure they fit. I have personally found that the child size surgical masks fit me best. The adult ones just allow a lot of air in and out around the corners. So, you know, check out your mask. And participants they could double mask, they could add a filter to their mask, they could add a surgical mask, either on top of a cloth mask. Anything that reduces air exchange can improve their masks. And then, are you still washing your hands for 20 seconds? I know that I've gotten a little faster, but making sure that we are, you know, sing the happy birthday song twice, really do that, that good hand washing. Indoor spaces and whenever there's more than one person, we really need to have good airflow with the windows open, which is certainly hard right now. It's 5 degrees at my house this morning. But we need to have the windows open if there's multiple people inside. We shouldn't be carpooling. Anything we can do to avoid crowds. And with our participants, if they haven't or aren't already, you know, can they get their groceries and medications delivered, or if they can pick them up curbside. Most groceries are doing this now, but participants may need help to set this up, because I know a lot of it is online. A lot of the ordering is online. So helping folks set up on curbside pickup or delivery. There's still a lot of volunteers in many areas to explore as an option. And then finally, which we're going to talk quite a bit about, get the vaccine as soon as it's available to you for everyone. The FDA came out with a statement today saying that there's really only 2 groups of people who should not get the vaccine. And they are people who are allergic to one of the ingredients, and people who had an allergic reaction to the first dose and therefore shouldn't get the second dose. Everyone else should be getting the vaccine at this point. So it feels a bit like we're in a race against the virus and against these new variants, these new mutations. And if the new variants come to Vermont prior to our participants getting vaccinated and getting protected, especially in our SASH buildings, there may be increased spread. So I think these are real priorities for us right now.
Casey, we've had a couple questions come in. So Susan Abel said that one of her residents asked if it was true that the Moderna vaccine was for poor people and the Pfizer vaccine was for the rich. I think that, I mean, the short answer there, and correct me if I'm wrong, is just that the Moderna is easier to, it doesn't need as many requirements as the cold storage. Is that correct?
That's correct. Yeah, there's really no, I think the only difference right now is the hospitals are doing more of the Pfizer because they have the cold storage. There has been some talk with the AstraZeneca and which ones are going to go to less wealthy countries. And so that may be where that question is coming from, that some less wealthy countries may have a harder time accessing the Pfizer and the Moderna, as opposed to different income levels within this country.
Thanks. We also had quite a bit of conversation around surgical masks because you mentioned that the child size fit you better. So surgical masks are not the same as N95, but I guess my question would be, do people have to wear the surgical masks, or are cloth masks still okay? Diana Rule Fenzel said that she doesn't have surgical masks. She's been using the masks from Costco, and then asked about how she would get surgical masks.
There's a lot of surgical masks. Can you still hear me, Mike?
We can. Yep.
Okay. Thanks. There's a lot of surgical masks you can buy. It's on Amazon. You can buy at Ocean State. They're not necessarily the ones that they would be using in the hospital. They don't have to be medical grade, but make sure they are 3-ply surgical masks. And they can be reused a little bit, but they're certainly disposable.
So Diana, it sounds like the ones that you're talking about are what Casey's talking about. And then the only other, somebody asked if we can still order from the Vermont Department of Health. I'm not sure about that, but I can check on that. And then Kim Russell asked where we could find a list of what's in the shot. You mentioned that people who are allergic to one of the ingredients should avoid it. And I guess that's a great question. How do we find out what the ingredients are?
I know that the ingredients list is on the Pfizer and the Moderna information sheets, which you can certainly find on their websites. I think those are also on the CDC website, and they will definitely give them to you before you get vaccinated. So when you sign the release that says you want a vaccine, the ingredients will be on that. And just one more thing about the mask. We are recommending that all SASH staff wear the surgical masks, not the cloth masks. So that's a recommendation from the Vermont Department of Health, that they just provide a little bit more protection.
And I will definitely reach out and find out if we can still order from the Vermont Department of Health and let people know. And I think that rounded out the questions. People are now just saying that they, if they sign on with a pharmacy, they get a list of the ingredients from that pharmacy with the paperwork.
Right. Yeah. I see a question from Kim about people who medically cannot get the regular flu shot. That probably has to do with ingredients. So it depends on which ingredient in the regular flu shot they can't have, and if it's the same one. So that's definitely, those are the folks who should be talking with their primary care and looking at those ingredients really carefully. Next slide, Amy. So some priorities right now, and we definitely want to encourage sites to schedule clinics and to start educating participants about the vaccine. There are clinics happening this week at a couple of housing sites that we know of. And the next tier of people are going to be 75 and up. So starting to educate our participants about what that's, encouraging them to get it and answering their questions about it. We have some infographics to share with you. Any participant that doesn't have a PCP, this is a great time to connect them with one, since a lot of these may be done through primary care offices. We also want to still be encouraging our participants to be prepared in case there are more restrictions in the case of a surge, with non-perishable food and medications and supplies they might need. We want to discourage participants from calling primary care to ask when they can get it. Can I get my vaccine? Most primary care do not have the vaccine yet, and their phone lines are totally overwhelmed with questions about that. At the same time, any participant should be encouraged to check with their primary care about receiving the vaccine at one of our clinics if they have any concerns. And that example Kim brought up about somebody not being able to get the flu vaccine, that would be a great thing for them to be calling and talking to their doctor about before they went down to your SASH vaccine clinic, and for them to have an answer that this was a good idea or not. Because there are some high-risk people who should be receiving the vaccine in a medical facility where there's doctors there who can treat a reaction very, very quickly. The last thing I want to say as far as things to talk to participants around right now is that this is probably a time to consider avoiding elective procedures that might lead to assisted living stays or nursing home stays, just because there is those facilities right now have a lot of outbreaks, and their staff are certainly overworked at the moment. There's a lot of, if there's an outbreak in a long-term care facility or a rehab facility, then people are quarantining in their rooms. They're not getting physical therapy. So this may just be a time to, if it's avoidable, to avoid anything that might land a participant into rehab right now. I know there was a bunch of chats which I wasn't able to follow. Anything that we should talk about before we go on?
Yep, there's just one question from Sarah Kucher, and she just said that when she's looking at the ingredient list, oftentimes she doesn't know what half of it is, and asked if there would be someone that might be able to answer those questions. I'm guessing maybe at the vaccine clinic, would the pharmacist be able to answer those questions?
Yes, I mean, a lot of them are very technical chemical names that I think somebody who's had a severe allergic reaction to something in the past would be able to identify, oh, that's one I shouldn't have, but not necessarily, and might be something they would want to talk to their primary care about.
And then Nancy Reynolds just asked, how do we know, how will SASH participants in the community know when vaccines are available to them? Will it be through their PCP? And I think that my understanding of that, Nancy, and Casey, please correct me if I'm wrong, but that is what they're working on right now for phase 1B, is those people that are 75 and older, or I think, Casey, you went through what the 1Bs will look like, or you're about to. And so I don't think that we know exactly how that word is getting out yet, but that's what they're working on currently.
The message from Governor Scott is that they will know when it is their turn, that there's going to be a huge educational push when it's people's turn, so that both from primary care and in all forms of media, people will be informed. Next slide. So one thing that participants and staff really need to be aware of is that we shouldn't change our behavior any once vaccinated. We still don't know if the vaccine reduces transmission. So we're going to need to continue to wear masks, continue to work remotely, continue the physical distancing. We do know that the vaccine prevents illness, but we don't know if that makes you become like a silent carrier instead. So we have to continue those. Also, it's a very scarce resource right now, which means that there's a lot of people who want it. But eventually there's going to be lots of vaccine. So right now there's a lot. It's very politicized. Who's getting it? Who's not getting it? We are going to need to just continue to be patient. As I mentioned, there are pharmacy clinics the federal pharmacy program clinics at some of our buildings happening starting this week. And that the full immune response is going to take up to 6 weeks. So again, that's back to the not change your behavior just because you got a vaccine. It's going to take quite a long time before people are fully protected by the vaccine. And then lastly, we're now able to record vaccination in PHL. And I saw that Jody chatted in that VDH thinks the 95 and up age group will be by the spring. And yes, I'm not sure exactly what spring means, but that's a nice general time to start thinking about that.
We also had a question come in from Kat asking about prioritizing when to go back into the office versus working from home. And Kat said that she's new, but she thought we were trying to be in the office when possible and just keep our distancing and masking, etc. The phone calls when possible, but from the office, is this correct or is it changing? No, Kat, I think that's right. And what you may not have seen or have been really familiar with yet is the phased approach. So in that phased approach, it will talk about if all work needs to be moved to remote in phase 1, or if some work can happen in person in phase 2. Most of our panels right now are somewhere between phase 2 and phase 3. So it is actually fine that you would be doing some of your work from the office, just staying sort of remote within the office. Hopefully that answers the question, but also that document is on STAR. And then it looks like I may have missed a question from Ann O'Brien, but I can't see it in my chat. So Amy, did you want to just read that question?
Yeah. She asked about questions about the vaccine and in the community. If we do not have all 40 people agreeing in our building to get them the first round, can we offer those doses allocated to community SASH members?
My understanding is that we cannot because it is a federal pharmacy congregate housing program. So by asking to bring community members in, it's no longer congregate housing, and that's what's being covered under this federal program. So even though that makes sense and would be super, super helpful, it's not allowed under the federal HUD 202 program right now. I saw there was also a question about going directly to the pharmacy to get the vaccine, and that probably will be able to happen in these later tiers, but that is not an option right now. The pharmacies don't have the vaccine yet to distribute to the public.
Casey, then Ann also asked what's going to happen to those allocated doses. So in your example, if they bring 40 doses to the panel and they don't get used, will those go to waste? And I think the answer to that is that we're being asked to be really specific about who's going to be getting it. So they're only trying to bring the exact number of doses, which is why we're filling out a bunch of paperwork beforehand. Right, and Sabina just said they're only bringing as many doses as we can confirm.
I was going to say my mom had the vaccine, and when they open up the thing, they had to give it to at least 10. They had to give it to 10 people, so there had to be 10 people waiting in order for them to give the vaccine to those folks. So it sounds like it's all on like allocation.
Yeah.
Another question, if most of the people in the building are 75 and over, but a few are 65 to 75 in the building, does that mean people in the building cannot all be given the vaccine? And no, so this is a separate program. When the pharmacy is coming in under the HUD 202 federal program, they are giving it to everyone in the congregate setting. So even I think some of our people are as young as 55. I believe that they are all being covered. And I did want to mention as well that at most of sites, the staff are also eligible to get the vaccine as part of this program. So if that's something that you're interested in or ready to do, that you should be talking with the people setting up the clinics there.
Okay, so we've had a couple more questions come in. So Sarah Kucher asks if a client has a concern or reservation about getting the vaccine, side effects, long-term care, or long-term effects, et cetera, who should they talk with? And that would be their primary care, Sarah. We're not saying not to call primary care. We're just saying don't call and say, when can I get it yet? Can I get it yet? Because they've been kind of inundated with calls like that. So if the person knows that they're about to be able to receive it and they have questions, absolutely call the PCP. That is appropriate to do at that time. Michelle Whitney asked, so even if someone is 30 living in a congregate setting, are they allowed to get it? And our understanding is that yes, if they are living in a congregate 202, HUD 202 setting, they're eligible regardless of age. And then Diana just said that's amazing. They have all but 2 people signed up for their clinic February 1st and 22nd, which is wonderful.
Wonderful. Yeah, that's great news. I would like to say too, as far as the question on who should participants talk to about concerns, they should definitely talk to their primary care. They can talk to the pharmacist, but they don't want people to sign up unless they're pretty sure they're getting the vaccine. So going down and having a long conversation about whether they should get it or not will just take time away from the clinic, but also then that allocated dose might be wasted, like Ann was bringing up. So people should be sure they are going to get the vaccine before they sign up and agree to go to the clinic. We do have a bunch of information we're going to share that staff can also share with participants if they have questions. So we'll share that in just a minute. We can go to the next slide, Amy. So as I was saying, you can now record an immunization in PHL, and we've added a couple of different choices here because we're not sure everybody's going to know what vaccine they got, but I think it will be super helpful to keep track of who's been vaccinated, how many people got vaccinated, potentially be important to know what they got vaccinated with in case down the road there's a mutation so that one works better than the other, or there's side effect concerns. So these are the different options. This will be on the client page. So you would go into add an immunization, and then when you go to the immunizations tab for a drop down, you're going to see all these choices over on your right. So COVID vaccine, the first dose of unknown. So for people who tell you, well, yeah, I got the vaccine, but I don't know what it is. I think that's going to be pretty rare because they're going to get a card indicating when they're due for their next dose. But in case that we wanted to make sure that was an option there. And then the Pfizer, the Moderna, and the AstraZeneca. AstraZeneca has not been authorized for emergency use yet, but it is anticipated. So we wanted to have that on there for when that hopefully happens.
Okay, Casey, we had a couple more questions. So Kim is just asking if the coordinator can enter the vaccine as well, or does it have to be the nurse?
Anyone can enter this. Yeah, it does not have to be the nurse.
And then Diana was asking about, she's got a vaccine coming up and she was going to schedule people 5 minutes apart as she had done for the flu clinic, but saying that people may need to stay for observation for up to 15 minutes after they get their vaccine. So that wouldn't work. And she's asking if she needs to schedule people 15 minutes apart. I would say to work with the pharmacy on that, Diana, and what they're showing in the visual is that you would have multiple people waiting in like a large space, socially distanced. But Casey, is there anything that you can add to that?
No, I think you're absolutely right. It's really going to depend on how much space you have for people to wait socially distanced after they receive the vaccine.
And then the last question was about, I guess, something that Biden said, and there was a question about if he, let me just read it. So it says, I joined late, so you may have already covered, with Biden's talk of possibly only giving 1 dose, will that impact our clinics that are scheduled after his inauguration? And then Sabina chatted in that he's not actually saying giving just 1 dose, but to not hold back doses for the second shots right now. And I think, Sabina, what you mean, and I don't mean to, I'm just trying to read here. I think right now they're sending both doses, and he's saying maybe only send 1, but I'm not sure. Casey, do you have anything that you can update about that?
Yeah, this is kind of a hot topic right now that lots of folks are talking about. England has decided to just vaccinate as many people as absolutely possible with 1 dose of the Pfizer vaccine, even though they know that that 2 is what's been studied, 2 is what's been shown to have 95%. There is some protection after the first vaccine, and because of what's happening in England, they are just trying to get everybody the first one, and they'll figure out the second one later. That is not being recommended right now in the United States. There's a whole bunch of reasons why, and I think that what has been talked about with Biden releasing all of the vaccines is to get more first doses into folks, but they're still planning on doing the second dose. How that's going to affect our supply, I really can't say. Okay.
Yeah, it looks like that kind of rounds that out. So it could just be that if they went that route, there would be a longer time between the first dose and the second dose, right?
Potentially. I mean, hopefully not, but potentially there. And there are people in the state right now getting their second dose already. So second doses have started in Vermont and in other areas of the country as well. I'm not sure how that's all going to play out.
Okay, I think that's all the questions for right now, Casey. Thank you.
Okay. Next slide. So as we mentioned with the prioritization, this is for Vermont. I'm not sure how Rhode Island and Minnesota are prioritizing, because some states are prioritizing essential workers before people over 75 or before age. Right now, we are in 1A, which is prioritizing licensed healthcare providers and support staff. There are some hospital service areas that are including SASH coordinators in that group as support staff, some that are not. So that's very hospital service area dependent. And the other part of 1A is long-term care, nursing homes, congregate housing, which is the HUD 202 federal pharmacy program. The next group is in Vermont, going to be people over 75, and then people 65 to 74, and then people under 65 with high-risk medical conditions. One of the hot topics at the moment is what is a high-risk medical condition and how do you decide which groups to include there, but that is currently under discussion. And as Jody was mentioning, they're hoping to have all of 75 and be started on this 65 to 74 by the spring.
It looks like Jody has her hand raised, so Amy's going to go ahead and unmute her.
Great.
So Jody, you've been unmuted. If you want to unmute yourself on your end, you're allowed to talk now if you wanted to ask your question.
Thank you. I posted something in a chat, and it says, not all housing organizations have this HUD 202 to work with. Pharmacies, Barre Housing Authority is working with VDH, local EMS, and other volunteers to roll out something called a closed pod. Anyone familiar with this type of rollout? Housing Authority, Barre Housing Authority has asked me to do oversight, and I was wondering if anyone has been asked, any nurses have been asked by their housing organizations for a similar responsibility.
Yeah, thank you, Jody. And I have not heard of any similar thing being set up. On the nursing call last week, there was a nurse who was talking about some clinics through the home health agency being worked on. I think there's a whole bunch of different ideas for how to reach these groups and how to reach congregate housing not included in HUD 202, which is the majority. A lot of our buildings around the state are not HUD 202. I think that's a very valid point. And there's a lot of different plans for how to reach them right now.
Yeah, and I guess that's
So
that seems to be putting out a lot of confusion. Just because, you know, I know in Central Vermont Home Health and Hospice, they have no plan as of yet. They haven't even been contacted about potentially rolling something out. Now that may be in the next couple of weeks they are, but I've included them in this meeting that we're going to have about with the Department of Health and EMS. So I was just wondering if any other nurses could speak to this kind of rolling out in a similar way as it is in Central Vermont.
Yeah, thank you. And definitely we need to keep communicating anything we hear about this or anything. And same with these clinics that are happening this week, lessons learned, what went well, what didn't, what do we need to do differently, and this is all happening so fast, and I think confusing is a good way to describe it. And that's at all levels, in the hospitals, in the health department. It's happening really fast with a lot more questions than there are answers. So thank you for bringing that up, and please chat in if anybody has anything else to add with knows any more about that pod idea and how that might work.
Casey, Ann had her hand raised too, so we're going to go ahead and unmute her, and then after Ann, we're going to move along to the next slide, okay?
Hey there, sorry I hit the hand raise.
Oh, I guess Ann doesn't have a question.
Okay,
All right,
Ann.
so then we'll
Thanks,
Fun.
Ann.
All right, thanks, Ann. I know how it works anyway. That's good. Okay, next slide, Amy. So as I mentioned, we are right now in phase 1A, and what I wanted to show with this slide is that the phases are going to overlap. So we're not going to have every healthcare provider vaccinated before they start with vaccinating people who are over 75. And also with this slide, you can see the weeks along the bottom. That's probably getting stretched out even more than this slide indicates, because it's been basically because we're not getting as many doses per week as we thought. But eventually there's going to be a lot of vaccine available, and it's going to be available to everyone, but that's going to take a while. Next slide. So a couple of things to consider for vaccine clinics at the SASH sites. We need to have really clear expectations with the pharmacy or with home health or whoever is running the clinic, what the expectations are for the SASH coordinator and the wellness nurse, what your role is, what your responsibilities are. We need to make sure that those expectations are within the scope of practice, especially for the nurses if they're being asked to do any medical thing, that's within our scope of practice. As we mentioned with an earlier question, we need to make sure there's a safe location for people to rest from 15 to 30 minutes after vaccine. There is some guidance that folks who have certain conditions, such as a history of allergic reaction, should wait longer than 15 minutes, that it should be closer to 30. Again, the pharmacies, if they're the ones running the clinics, would be the ones who make that determination, how long somebody should wait. We need to know who's going to be doing that monitoring for side effects and reactions, and who's going to treat any reaction that happens. So who's going to administer epinephrine, who's going to give oral Benadryl, who's going to call 911, those kinds of things we need to have ahead of time. We need to know who's bringing it, who's giving it, and how that's all working. And as I mentioned, staff should be able to receive the vaccine at the clinic. If you're helping at the clinic, you should probably get the vaccine at the end, so that if you don't feel well, if you have some of the nurses reported just feeling exhausted right away, so that you can basically have the rest of the day off. The question, do people have to lay down? They do not. They just need to be have eyes on for 15 to 30 minutes. There are places in other parts of the country who are doing this in their car, so it's a drive-by clinic, and people just sit in their car for 15 minutes and then they get the all clear and they drive home. So that you don't need to lie down. It may be valuable to have a place to do that in case somebody has a reaction, but that's not required for sure. Next slide. So I wanted to kind of quickly go through the signs and symptoms of anaphylaxis, since that is the biggest concern at the moment. I do want to highlight that there have been over 4.8 million vaccinations done in the United States so far, and there's been 29 cases of anaphylaxis. So this is a pretty rare occurrence. About 5.5 per million doses of the vaccine have an allergic reaction to it. So pretty rare, but still important that you can recognize what it looks like. Whether you're monitoring a clinic or not, you might get a call from somebody who said that they had the vaccine earlier in the day or yesterday, and need to be able to recognize that. This is the best one I could get is for an infographic for anaphylaxis. This is for a food allergy. So some of the symptoms are going to be just a little bit different. So I'm going to stop and make sure you can still see me again because I think I was kicked off again.
Yes, we can. Your
Can you still
video's
hear me?
frozen, but we can see you and hear.
Okay.
Yeah.
Okay, great. I'll try to get back in. So symptoms of anaphylaxis, the biggest one that we're watching for is difficulty breathing. And so people may get short of breath, they may get very blue around the lips, so that's a big one. Another one is kind of a sense of impending doom or feeling a sudden fear, sudden rush. Heart rate might go up, blood pressure may go down. Rash is a big one. So people may break out in hives. Those are things to watch for. Melissa, if you could jump in and just read anything else that's on that slide. I can't see it at the moment. I do want to talk about the treatments, but any other symptoms that I'm skipping over there?
We can't hear
Can
you,
you guys
Melissa.
still hear me? Oh dear. Well, I can go to treatment.
Well, I can tell you, it does say there's
Okay.
severe vomiting and diarrhea, which you hadn't mentioned, and then just some itchiness around the mouth and nose and that kind of thing.
Yeah, and the reason those may occur, certainly those are more likely with a food type allergy, but nausea and vomiting would be certainly a concern. So treatment, if this happens, is that we are going to there hopefully will be epinephrine available. So epinephrine would be the first treatment, and that would come from the pharmacist at these pharmacy ones anyway. And then anytime you are suspecting anaphylaxis or treating with epinephrine, you're also going to be calling 911. So at that time, you should immediately be on the phone for an ambulance because they have additional medications. Somebody with a severe reaction may need more than one dose of epinephrine. Additionally, oral Benadryl or injectable Benadryl is another medication that could be given both by the pharmacist. And then trying to keep somebody calm, if possible, elevating their feet or lying them down. So if you have a participant who you fear is having an allergic reaction, the biggest thing for you to do is to call 911 and get an ambulance there to check on them. Any questions or comments on that, Amy?
No, there hasn't been any, and it looks like we've lost Melissa's audio. So,
Okay.
Oh, Karen Lipinsick just said, can you give that percentage of reactions?
It was 5.5 per 1 million.
Okay.
Is the percentage I'm seeing at the moment.
Then Ann O'Brien.
Oh,
sorry. Go ahead.
I mean, that may change as more and more people are vaccinated, but yeah, go ahead, Ann.
Okay.
Ann
said for pharmacy clinic from CVS, they are bringing 6 EpiPens to each clinic according to their training. So that's great.
Great. So that should be more than adequate for that.
Melissa, did you want to say anything? Hold on.
Oh.
No, we can't hear you, Melissa. I can see Melissa talking, but I can't hear her. We're having so many. Oh, there you are. Okay, now we can. Yeah, good.
I knew that was going to happen today. I could just tell. Okay, so I'm sorry, I didn't mean to interrupt, but are we ready to move on to the next slide?
Yep.
Yeah.
Okay. Perfect. So I found this, the CDC, I know that you all have been asking about education for participants, and so the next few slides, and I'm going to go through them kind of quick, but we found some really great education that's been put out recently. So this one is from the CDC. There's the website there on the page, and we'll share it after the fact, but it talks about making a strong recommendation for COVID-19. And so they have 5 recommendations, starting from They want you to start from a place of empathy and understanding, assume that patients will want to be vaccinated but may not know when to expect it, give strong recommendations such as those listed below. And I personally like the last one best. I could feel myself saying that. I believe in this vaccine so strongly that I'm going to get it as soon as I'm able to. But find the one that's comfortable for you. Listen and respond to patients' questions, which we will have a few extra slides about that. And then also they give guidance on how to wrap up the conversation, such as letting them know that you're open to continuing the conversation and encouraging them to take at least one action, such as scheduling another appointment to discuss, reading the additional information that you provide, and just explaining that they understand that these vaccines are new and participants' comfort level with them will vary. So this was just put out. There's a lot more information after each one. If you go to that website, you can read up on it. This is a slide that helps answer some of those questions that might come up. It's a FAQ put out by CDC, and so you could have this kind of handy when you're ready to start, thanks Amy, when you're ready to start talking about vaccines with participants. You could even share this with them. It's just some of the most common questions and answers for them. Next slide, Amy. This one is a sort of a front and back one pager that walks through, I think rather than the question answer format of the last one, this just walks through as an infographic and talks about if they're safe, what the side effects are, what you should expect when you go to have them. So I thought this looked like it might be really helpful. And then the thing I like the most about this one is down on the bottom right. It talks about how even after you get your vaccines, you're still going to need to have to wear the mask, wash your hands, keep socially distanced. And I think that that's really the message that we're going to want to drive home to our participants is that, especially after that first dose, but maybe even after the second, it's going to take time. And so you're going to have to keep doing the things that we've been doing all along. Next slide, Amy. So once you receive the vaccine, you'll be able to sign on to vSafe. This is through the CDC, so it's available for all states. It's not V for Vermont, V for vaccine. And it's a way that you can tell the CDC about any side effects that you may have after getting the vaccine. It also provides reminders to get your second dose. So this is an app on your phone that you can sign on to once you do get the vaccine. Next slide, Amy. And then this is a helpful infographic, again, put out by the CDC about what to expect after getting the COVID-19 vaccine. It's seen here both in English and Spanish. It has common side effects, helpful tips, when to call the doctor, as well as reminders, and then a place to enter your own healthcare information so you can kind of have this at the ready with you. And that all of these will be posted to STAR after the call. Next slide, Amy.
Just so you know, I created a whole section of this in STAR this morning first thing, so they're already on STAR.
You're amazing. Okay, thank you.
Back at you.
And then getting back to normal. So this is like I was talking about before. It's the same infographic, but you could put this up around your building just saying that we still need to keep using all of these tools that we've learned over the last year. So we're going to get the vaccine, but we're also still going to wear the masks, stay distanced, and wash our hands often. Next slide. This one I found, I just thought it was interesting. The WHO put this out about how a vaccine is created, and it's this 3-installation sort of article with really great just infographics throughout talking about how they've created the vaccine. And I know that's been a question that people have had, both staff and participants, my family, you name it. So I really liked this was very layman's terms. It made it really easy to digest and understand how they're creating this new vaccine for a pathogen that we've never seen before. Next slide, Amy. I think this goes back to Casey here. Yep.
So one of the priorities nationally and in Vermont is to try to target the BIPOC community. And so BIPOC stands for Black, Indigenous, and People of Color. It's an acronym that's been around for a while, but all of a sudden getting a lot of press. As you know, the BIPOC community has been disproportionately affected by COVID-19 with much higher rates of illness and death. And that's across the country and in Vermont. So new Americans and non-English speaking participants really need information both about COVID and about the vaccines. and the state wants to prioritize these communities, and the main way they are going to do that is with appropriate outreach and education, and also hosting clinics in the communities. So there's a couple of ways that we can really support that. There's some YouTube videos, which I'll show you in just a moment, that have been put together by the Vermont Department of Health. And then there's going to be a series of meetings, virtual meetings with Dr. Mercedes Avila, who you recognize her name. She spoke on one of our SASH coordinator calls a few months ago, meetings in multiple different languages about the vaccine and about immunizations. So we have new Americans, we have non-English speaking participants and residents in our buildings. So really want us to prioritize reaching out to those folks with information. Next slide, Amy. So this website is from the Vermont Multilingual Coronavirus Task Force, and it has short videos in a whole bunch of different languages. There's mostly, this is put together through UVM. Each one has a native speaker speaking about different parts of what folks need to know. So in this case, there's a video about the quarantine rules that Governor Scott instituted back in November, explaining when and why to quarantine in native language. So there's Arabic, there's Burmese, there's Maya Maya, there's Spanish, French, and about 10 other languages. So please visit this website. Also, in the very near future, and I don't know if it will be this week or not before our clinics start to happen, but in the very near future, there will be these little videos explaining the vaccine in these languages as well. So they're actively working on getting these videos put together and getting them out. This is a YouTube page from VDH and their coronavirus task force. The link to this page is also on STAR.
Casey, would these be also useful for our Minnesota or Rhode Island folks?
These specific ones probably will not be, because they are specific to, how to get to the testing site in Winooski. And this is what Governor Scott said last week. But I'm making an assumption that these kinds of resources are also either developed or in process of being developed in Minnesota and Rhode Island, and I'm happy to do some research looking for them. Just didn't have the time to do that for this call, but I'm happy to help with that. I just learned about this resource on Friday.
Okay, thank you so much.
You're still muted, Melissa. We still can't hear you for some reason. So
how about now?
There we go. Okay.
That's what happens when you're on the phone and the computer. So we have a poll. We want to do this real quick and just see how many of you would benefit from having translated information about the vaccine. And then if yes, so go ahead and vote. But if you do say yes, please in the chat real quick, just let me know what language would be helpful. The city of Burlington as well as UVM both are working on translating information. And so we want to make sure that we can get that out to you as soon as we get it, and we're getting it in the languages that you need. So if you could just answer and let me know if that would be helpful, and then also which language you're looking for, that would be great.
I did see a request in the chat right before the looking for printed material in multiple languages. There are a lot of tools on CDC in the CDC website that have been put into multiple languages, but I'm not sure about these specific ones we shared today. So definitely chat in if there's a specific language you need.
Okay, I'm going to close the poll. Yep.
Awesome, thank you.
So I just shared the results. So it looks like for majority of folks here, it's, or maybe I shouldn't say majority. Yeah, majority of those not really helpful, but for those who were about 28%, they did type in the chat what would be helpful for them. So thank you guys.
That's great. We will get to work on trying to get those and get those out to you. I think they're being developed right now, so it might not be immediate, but as soon as we get them, we will share them. And then Amy, if you can just get us to the quote of the week, I wanted to just round out. This was the quote from Governor Phil Scott. He mentioned this during his third inaugural address on January 7th. He said, it's been 306 days since that first case. Every choice we've made since has been difficult, but every step of the way, they've been guided by the best possible science and data and a team of talented Vermonters whose job placed them at the center of our response, working day and night to protect their neighbors through this historic storm. And I just wanted to share this quote because it just struck me. I heard it on the 7th, and I don't think I've really stopped thinking about it since then. I actually have to go back and listen to the rest of the governor's speech because I didn't hear much of it after that. I don't know. I've been nose to the ground working on this day in and day out, but I haven't really given myself the time to sit back and reflect. And I think that hearing 306 days just kind of stopped me in my tracks and made me do that. So, you know, with that being said, I haven't stopped thinking about this. I don't think a day has gone by that I haven't thought about it. Some days it's been all I've thought about. And yet I've had other things that I needed to think about too, including several family members that were dealing with health issues, a daughter learning to drive, an adorable but total pain of a dog, my normal job. I mean, I'm sure you all have similar things where there's been happy and sad, but also just a constant COVID. And more than anything, I just want to acknowledge that. And I want to thank you all for the amazing work that you've done over these past 300 plus days that you did prior to COVID and that you're still doing. It's clear to me that we have all made a huge impact on your participants and will continue to do so. And I just want to thank you for everything and round it out with, you know, my sincere gratitude. So we will talk again in 2 weeks. We'll get you any information we can before then based on the questions you had on this call. And if there's anything that you're hoping we can cover next time, let us know. Thank you, guys.